I'm Hank Green. I'm a science communicator and a cancer survivor, and November is Lung Cancer Awareness Month. In the last year, I have lost 2 friends to lung cancer. Both of them were in their 50s, both were healthy, neither of them were smokers. One of them was my friend Susan Wojcicki, the former CEO of YouTube. And to carry on Susan's legacy, YouTube shared a post that she wrote in the final weeks of her life that she planned to publish. She wrote about her diagnosis and the fact that lung cancer research is underfunded, despite being the #1 cause of cancer death in women, and that lung cancer among people who have never smoked has been rising. Now, people who smoke are around 20 times more likely to get lung cancer than non-smokers, and smoking causes around 30% of all cancers in wealthy countries. That's not all lung cancers, that's all cancers. But as fewer and fewer people smoke, that means a greater and greater proportion of lung cancer cases are in non-smokers. Right now, more than 20% of lung cancer cases in the US are in non-smokers, and since lung cancer is the most common cause of cancer death, that's a whole lot of people. We need to get it out of our heads that lung cancer is only a disease of people who smoke, so that people who don't smoke can know that this can also happen to them. And these cases in people who don't smoke are actually different. They're more likely to be diagnosed late, they're more likely to be influenced in part by harmful genetic mutations, patients are much more likely to be women, and on average, patients take longer to seek medical care after they start experiencing symptoms. And in all lung cancers, those symptoms are often surprisingly mild. You might get pain in the chest when breathing deep or laughing, a persistent cough, hoarse voice, shortness of breath, wheezing or pneumonia, a loss of appetite or feeling tired or weak. And as with many cancers, a very common unrecognized symptom is unexplained weight loss. And when we look at lung cancers across demographics, we find that Black and Hispanic Americans are less likely to receive certain lung cancer treatments, including surgery or genetic testing, and are less likely to survive 5 years after diagnosis compared with white Americans. Black males have the highest rate of lung cancer death among all racial groups. There are things we can do about this. First, no one should smoke ever, at all. Again, 30% of all cancer cases in the US would not happen without smoking. There are also risk factors outside of smoking, which include exposure to radon, secondhand smoke, air pollution, asbestos, or diesel exhaust. Radon kits are cheap now, often less than $20. If you live in an area that might have high levels of radon, which is a pretty easy thing to Google, you should look into getting a test. We should also, and I know this is like a weird cancer prevention strategy, but we should move away from all technologies that include burning stuff. Next time you upgrade your stove, you should not get a gas range. You should get induction or electric. Gas ranges produce compounds that are known to be carcinogenic and that build up in the interior environments of our home that we then breathe into our bodies while we're cooking. We should, of course, continue to phase out coal-fired power plants, and we should continue the transition to electric vehicles. Of course, we also need to keep doing research into the causes and on treatments. But we can also do a better job of detecting lung cancer early. The prognosis for late-stage lung cancer is very bad. It is one of the most deadly cancers, and once it has spread, it is very difficult to control. But there is much more that doctors can do for patients who are diagnosed early. So if you are at high risk, whether because of a family history or genetic mutations, which you can get tests for, or most importantly, a history of smoking, you can get screened. There's a bunch of reasons why various scans aren't actually great at detecting lung cancers. MRIs, for example, can't detect early lung cancer because the lungs have this nasty habit of moving around a lot while you breathe, and that can make MRI images of the lungs blurry, making small cancers hard to detect. But good old-fashioned X-rays are much better at this. X-rays, however, can increase cancer risk. So doctors and researchers have developed a special low-dose X-ray test for lung cancer screening called a low-dose CT that's often provided free of cost for people who have higher risk of lung cancer. And even those without high risk can ask their doctor about it. Having been through my own cancer journey, I am fully aware that there are no magic bullets. Our fight against cancer has to be fought from many angles, and it is constantly evolving. But if there's one thing I know about people, it is that we do not accept the world as it is, and we will continue to fight to make it better.